Hello, Kim Krauser here from Interlude Mind Body Fitness. I've got Jillian here demonstrating the pelvic position in the Stop Pilates technique. And before we actually look at optimum pelvic position, we're going to get you moving a little bit. So Jillian is laying down. She's got her legs bent. Feet are about hip distance apart. About a 90-degree bend here at the knees. In her upper body, arms are relaxed by the sides. You can have your palms down or you can flip your palms up toward the ceiling. Notice that Jillian has a cushion underneath her head. This is just to eliminate any unnecessary tension that she might be carrying through her neck and her shoulders. So the first thing that I'd like you to do is just landmark some important bones that you can touch in the front of your pelvis. So go ahead, Jillian, and put the heels of your hands down at the two pelvic bones on either side of your pelvis. Then let your fingertips meet at the middle bone, the pubic bone. So you're making this triangular shape with your hands. So now you can sense or feel these three bones. And now as you start to move your pelvis, so Jillian's rocking down toward the tip of her tail, allowing her low back to arc up and away, then rocking in the other direction, letting her low back flatten. So as you go through this full range of rocking, you should sense the weight transfer on the back of the body, the pelvis and the low back. So you should feel, as you rock down to the tip of the tail, that your low back is arcing higher off the mat. As you go the other way and curl your tail toward the ceiling, you should feel your low back lengthening and making contact with the mat. Also, underneath your hands, you should feel those three bones changing their relationship to one another. As you flatten your back into the mat, you should feel the pubic bone, that center bone, rising higher than the two side pelvic bones. When you go in the opposite direction, arching your back off the mat, you should feel the pubic bone drop below. So do that a few times, making sure you're not holding your breath, making sure that there's no unnecessary tension through the neck and shoulders. Great. Now bring your hands down by your sides. And now as you keep that rock going, let's refine it a little bit more. So continue to go through, and of course you want to go through a large range of motion, but not a range of motion that creates any discomfort. So if you find when you go into certain end points that there's any discomfort in your low back, then stop before you trigger any kind of pain response. So always work within the boundaries of no discomfort. And what I'm watching for, what you want to sense as you're doing it, is there a change happening in your upper body as you're moving your pelvis and your low back? If you feel like your chest is lifting or even your head and neck are moving with the pelvis, then the motion that you're doing is a little bit too large. I want you to refine it, reduce it until you're not disturbing the upper half of the body. So the rib cage should remain relatively stable, should be relaxed. It should be responding to your breathing, but not responding to the movement of the pelvis and the low back. The neck as well. If your motion is too big, then you are going to feel like your head and your neck are moving. Let's refine it a little bit further. This time, continue to pay attention to what's happening in the upper body, but now I want you to reduce the rocking action until you are really finding the movement from the breath, from the abdominals, and from the muscles around the pelvis and into low back. So if you notice down at the other end, if you notice your feet as you're going through that rock, are you pushing your feet into the mat to facilitate motion? Are you utilizing the bigger muscles of your legs through the hamstrings into the glutes to move the pelvis? If you're noticing that you're doing that, see if you can relax the muscles through the backs of the legs. Can you relax the glutes and the hamstrings, not use these muscles, not drive your motion from these muscles? Try to avoid pushing into your feet, but see if you can still create that motion. It will not probably be as big a motion as you would get if you use those larger muscles, but what we're trying to do is trying to find the subtlety in this action, trying to move the pelvis and the low back using the muscles through the core to make it happen. Finally, once you've gone through that rocking action, see if you can settle, and you can go ahead, Jillian, put your hands back on those landmark bones in the pelvis, and stop your motion when you sense that those 3 bones are level with one another. So the 2 side bones and the pubic bone are on the same horizontal plane. If you can set that position up, you should feel like you have more weight down towards your tailbone. You should feel like you have a little bit of a curve, a lightness in the low back. This is your ideal neutral position for the pelvis and the low back. This is the place we are often going to work from when we do upper body motion in this laying down supine position, and when we do lower body motion using the legs moving through space. So there's pelvic position. Thanks for watching.